Can you answer these 5 NCLEX style practice questions about pneumothorax? Better question, do you want to learn to think like a nurse and get comfortably passing grades when it comes to this topic? In this video, I'm going to challenge you with real NCLEX style test questions, walk you through the best test taking strategy for nursing school, and teach you something about pneumothorax you've probably never learned before. If you're ready to stop memorizing and start learning to think like a nurse, let's get started.
Let's get started learning to teach you to think like a nurse. Question 1. A nurse is assessing a client who has just had a chest tube inserted for a pneumothorax. Which of the following findings would indicate that the chest tube is functioning properly? Let's stop and ask the one question that rules them all. What do we need to know before we can answer this question? We see words like chest tube and pneumothorax. So we probably want to know a little bit about what is pneumothorax. If you study with my Silver Bullet study system, which I highly recommend because it's the best way to study, and I have a free overview that teaches you how to do it in 10 minutes if you click on the link below this video description. But if you've been studying that way, this would be step 2. You need to know step 2 for pneumothorax. Because the pathophysiology for a pneumothorax is a hole in your lungs. It's where air can accumulate in the pleural space or escape from the pleural space. But there's a problem with the air, which is not supposed to be in the pleural space, can now get there. And also knowing a little bit about chest tubes, how they function, how they set up, how we can maintain them as a nurse. A lot of questions you will see about pneumothorax on your nursing tests is going to be related to chest tubes. Once we've activated some of our brain's knowledge, we're going to remind ourselves of what the question is asking, which is, which of the following findings indicate that the chest tube is functioning properly? Let's look at the answers. A, continuous bubbling in the water seal chamber. B, fluctuation of the fluid level in the water seal chamber with respiration. C, absence of drainage in the collection chamber. Or D, intermittent bubbling in the suction control chamber. Before I show you the answer, I like to model how I think through these questions when I'm trying to answer them as an experienced nurse. I treat each answer option like a true-false, and I start from that. So if I see continuous bubbling in the water seal chamber, is that correct or not correct? Because I know my step 1 normal, that's from the Silver Bullet study system too, about chest tubes, I know that the purpose of the water seal chamber is to provide that sealing so that the lungs can stay at a negative pressure, which is the reason why they can normally expand and contract. When there's a hole in the pleura, the negative pressure balance is messed up. And that's what causes all the symptoms you see in a pneumothorax, is because without that negative pressure, our diaphragm cannot help our lungs expand and contract as well. And if it doesn't expand and contract, air does not go into our lungs. Think of it like a vacuum cleaner. So I know that the water seal chamber is temporarily replacing the seal that the pleura would normally provide so that we can maintain negative pressure in the lungs. Therefore, we would not expect continuous bubbling in the water seal chamber. There should only be bubbling when the pleura is failing at doing the negative pressure, which is only at certain times during respiration when the negative pressure should be activating. So I don't like this answer. B, fluctuation of the fluid level in the water seal chamber with respiration. This one sounds better to me because as I breathe in and out, the pressure should be changing, which means the water level should respond to that change in pressure. So I do like this answer choice. C, absence of drainage in the collection chamber. I do not like this. We should have drainage. If there's something going on with the pleura, we want to be getting it out of there. There's going to be some kind of immune response. There's going to be mucus accumulating, and we want to get that out of the body. I do not like answer choice C. D, intermittent bubbling in the suction control chamber. This is probably the best distractor, and the reason why is because intermittent bubbling in the water seal chamber is normal, but we're not talking about the water seal chamber. We're talking about the suction control chamber. Therefore, I'm crossing this one out. That leaves answer B as the correct answer. Fluctuation of the fluid level in the water seal chamber with respiration. Did you get it correct? Question number 2. A client presents to the emergency department with a suspected tension pneumothorax following a motor vehicle accident. Which of the following clinical signs should the nurse expect to observe? First, what do we need to know in order to be able to answer this question? We need to know, what is a tension pneumothorax compared to a regular pneumothorax? And I happen to know a tension pneumothorax is a variation of a pneumothorax where the negative pressure is messed up. But in this case, it's done in a way that the pleura is actually sealed. So as the air leaves the lungs and goes into the pleural space, it gets trapped and it can't escape. So your pleural space ends up getting blown up by like a balloon. And there's only so much room inside your chest. So as the pleura gets blown up by a balloon, it's pushing your lungs and all your other internal organs to the other side. And step 3 of the silver bullet study system, we can predict that if it does that, the lungs are connected to our trachea. So our trachea is also going to deviate to the side that it's being pushed away to. This is the stereotypical symptom that most nursing students are taught to memorize for tension pneumothorax. But now you understand why it actually happens so that you'll never forget it and you'll never get tricked. A, hypertension and bradycardia. And let's remind ourselves, what is it we're looking for? Which of the following clinical signs, basically symptoms, should the nurse expect to observe? And this is with a tension pneumothorax. Would we expect to see hypertension and bradycardia? Not necessarily. I can't think of a reason why I would predict hypertension to happen for tension pneumothorax, other than maybe a general response to trauma. And that's not specific to a tension pneumothorax. Bradycardia, maybe if the lungs were squishing my heart, it would respond with bradycardia, but maybe it would do tachycardia too. Who knows, right? So don't love this answer. Let's see if we can find something better. B, tracheal deviation towards the affected side. Here's our stereotypical answer. But is it? Don't let yourself get tricked. This is the best distractor, and here's why. Because the tracheal deviation, the direction the trachea moves, is not towards the affected side. It is opposite of the affected side. Remember, if the pleural space is blowing up like a balloon here, the trachea is not moving closer to that balloon. It's going to be pushed away from that balloon. This one is the best distractor because if you only focus on memorizing the symptoms without understanding them, then you have no anchor to think through these options. And you're more likely to have your brain just looking for something you recognize, and then you choose it without actually thinking like a nurse. We can confidently eliminate option B. C, diminished breath sounds on the affected side. This one I like a lot better because if we are blowing up like a balloon on one side of the lungs, that means the lungs can't do their normal job. And in the course of their normal job, I would be able to hear breath sounds. But now the air is not able to pass through the lungs. That's what we're listening for when we are listening for breath sounds, the movement of air. But the air is getting trapped in the pleural space. Once it's trapped in there, it's not moving. We might hear a little bit because air can come in, it can go through the lungs and into the pleural space, but then it stays there. That's what makes this a medical emergency. Therefore, the breath sounds are going to be diminished. So I really like C, but we have to look at them all. Hyperresonance on percussion of the unaffected side. This is pulling back to health assessment class and percussion. You have to know step 1 normal about percussion, which is what would cause the hyperresonance sound. And usually it's going to be like banging on a drum. It's kind of hollow. But we know it is not going to be hollow on the unaffected side because all the organs are getting squished over there. So there's going to be a solid mass of stuff. We do not expect to hear hyperresonance on percussion. Therefore, the correct answer is C, diminished breath sounds on the affected side. Did you get it correct or did you get tricked? Question number 3. A nurse is caring for a client diagnosed with a spontaneous pneumothorax. Which of the following interventions should the nurse anticipate as a priority? Let's look at the answer choices. And I want to let you know, I got this one wrong when I was practicing. So I don't want you to ever feel like you always have to get them correct. Even experienced nurses with over 16 years of tutoring experience don't know everything and find these questions difficult. Let's talk through the answer choices. What do we need to know? We need to know what a spontaneous pneumothorax is, which we've already covered in the previous questions. And we need to know what are some things we would expect to do to help take care of that. A, administering a bronchodilator. Is this something we would do? I say no. A bronchodilator expands the bronchi, but the bronchi is not where the problem of a pneumothorax is happening. This may make it a little bit easier for the patient to breathe because it's opening up the airway, but that's also allowing the air to get into the pleural space faster. So it's not really addressing the root problem. B, preparing the client for chest tube insertion. Obviously, I like this because we know we are going to be giving a client with pneumothorax a chest tube at some point. My only question right now is, Prioritization. Is the chest tube going to be the first thing we do, or is there something else we need to do first? I'm keeping this answer for now. C, providing supplemental oxygen. I like this answer too. It's something quick and easy we can do. It doesn't risk making the pneumothorax worse, and it helps maximize the patient's oxygenation while we are waiting to treat it. So I'm going to keep this one also for now. D, positioning the client in a high Fowler's position. This is also a pretty good distractor because I even teach my tutoring students that whenever you have a respiratory problem, putting them in semi or high Fowler's position is almost always the correct answer. However, I don't think it is here. Normally, we put them in that position because removing gravity off of their chest helps make it easier to inhale and exhale. That's not the problem we're having with pneumothorax, though, so I'm going to eliminate it. That brings us to B or C. This is where I prioritized incorrectly. Let's look at the answer choices and see if you made the same mistake I did. The correct answer is prepare the client for chest tube insertion. I incorrectly chose provide supplemental oxygen because I thought, let's get the oxygen on them first, and then we're going to do the chest tube. Where I let myself get tricked in this question is because priority doesn't always mean first. Sometimes priority means what's most closely tied to fixing the root problem. And one way I could have prevented myself from getting this wrong is by asking a simple test-taking strategy question that I teach my tutoring students to use. And that is, if I could only do one nursing intervention and then I had to go home, which one would I do? And in that case, it becomes a lot more obvious that the chest tube insertion is what we want. The supplemental oxygen, while good, while something we probably would also do, is not going to be enough because they still don't have the negative pressure in their lungs to breathe properly. But once we're ready for chest tube insertion, the chest tube is going to fix their problem. Therefore, that is the priority. If I can only do one thing as a nurse and then I have to go home, what is going to help me sleep tonight? It's going to be this one. Now, am I worried if I get one question wrong? Should you be worried if you get one question wrong? No. This is why I am not the tutor to get you 100% on your exams. I am not interested in helping you get straight A's, believe it or not. I want to help you get comfortably passing grades, learn to think like a nurse, and do it all without getting burned out. Some questions you're just never going to get right, and that's okay, because as long as you were getting most of them right, you're going to get comfortably passing grades, you're going to learn to think like a nurse, and you're going to do it without getting burnt out. If you like that philosophy of tutoring, check out my Study Like a Nurse tutoring community because I can help you out. Question number 4 is a select all that apply. We love select all that apply. The nurse is monitoring a client who had a chest tube inserted for a hemothorax. Which of the following findings should the nurse report to the healthcare provider? Select all that apply. What do we need to know? We need to know about a hemothorax. This is different than a pneumothorax, right? Sort of. We see the root word hemo instead of pneumo. Pneumo has to do with air and lungs. Hemo has to do with blood. Instead of air getting stuck in the pleura, we have blood getting stuck in the pleura. It can still be treated with a chest tube. We still need to know all these things about a chest tube. And what the question is asking us is to predict the step 3 symptoms that we would expect to see if something is going wrong, like a serious complication sort of wrong, specifically after they have been treated with a chest tube. Here's the answer options. A, continuous bubbling in the water seal chamber. We already talked about this. This is a problem. This is something that is not normal, so I want to choose this one. Let's see what else we choose. B, drainage of 100 milliliters in the first hour post-insertion. This sounds okay. We expect drainage, especially right away when the chest tube has been inserted. We're trying to drain out that blood that's stuck in the pleural space. I would not need to report this to the provider. It's expected. C, sudden cessation of drainage. Cessation means it stopped. That's not a good sign if it's sudden. If it's gradually tapering off over the course of a few days, that's a good sign. It means it's healing. But to suddenly stop sounds more like a kink in the tubing. This gets reported. D, fluctuation of the fluid level in the water seal chamber with respiration. We already discussed in a previous question, this is normal behavior in a chest tube. Do not report this. E, redness and swelling at the insertion site. This is a reasonable distractor because we might expect some irritation at the insertion site. I mean, we did cut somebody open to put the tube in, but redness and swelling sound to me like more of an possible infection response. Therefore, I think this is something reportable. And those are the correct answers. A, C, and E. Did you get them right? Did you get some of them right? Question number 5. A nurse is caring for a client who recently had a chest tube placed for a pneumothorax. Upon assessment, the nurse finds that the chest tube is dislodged from the insertion site. What is the nurse's priority action? What do we need to know to answer this question? We need to know about chest tubes. We need to know about pneumothorax. We need to know, what do we do when the chest tube gets messed up, specifically by coming out of the insertion site? Answer options. A, apply an occlusive dressing over the insertion site. What's an occlusive dressing? It's something that blocks. It's not breathable. Is this something we would do? Maybe. Because if we think about the normal function of the chest tube, it's supposed to replace the negative pressure that we've lost with the pleural damage. But if we lose the chest tube, we still want that negative space maintained as much as possible. And right now the chest is open to air. So if we put an occlusive dressing that is not as good as a chest tube, but it temporarily creates an opportunity for negative pressure because it blocks the air from being able to come in and out of that chest hole. So A is a definite maybe. B, reinsert the chest tube immediately. No. And just because you stick the chest tube back in the chest doesn't mean it's actually going where it needs to go. This is not a good idea. C, notify the healthcare provider. If you are in nursing school, this is never the answer. There is almost always something you can do first as a nurse before you notify the healthcare provider. If you don't believe me, ask this question. When I call the healthcare provider, what are they going to ask me if I have done yet? And there is definitely something they would ask you if you have done yet. C is not the correct answer. D, secure the test tube with tape. Although the word secure always sounds good, it's not going to help anything in this situation because the chest tube is already dislodged. We could secure it to the chest, but it's still dislodged. Therefore, this is not the correct answer. That makes the correct answer, apply an occlusive dressing over the insertion site. Now notice, even if you were not 100% sure that this was the correct answer, when you have a strategy for how to think through each individual answer, we were able to eliminate the others for very valid reasons that we're confident about, which means that we can also be confident about the final answer that we're choosing. What was your score? How did you do? Did you get all 5 correct or did you get one wrong like I did? Tell me in the comments. And if you would like to learn more about pneumothorax, head on over to this video over here where I will teach it to you using the Silver Bullet Study System method. When you understand it with the Silver Bullet Study System, you will never forget it, and you don't even have to memorize the symptoms. You'll be able to figure them out on the spot. Same with the nursing care. If you're good with pneumothorax, head on over here because this is the next video for you. Either way, see you there.